Boston Keratoprosthesis was developed by Clay Stoneman and FDA approved in 1992. The traditional Boston KPro consists of a donor corneal tissue mounted onto an optical stem and secured with a titanium backplate, typically characterized by a Swiss cheese design, and it's locked in place by a titanium ring. Now, this device is often reserved for patients with severe corneal disease, such as those with corneal opacities, aphakia, aniridia, limbal stem cell deficiency from conditions such as chemical burns or Stevens-Johnson syndrome, and especially in cases of multiple failed corneal grafts. Now, for many patients, this represents the only viable option for visual rehabilitation. Now, interestingly, there's a new version of the KPro, and that is the so-called Lucia type variant, which was FDA approved in 2019. There is no actual advantage compared to a conventional one, but by eliminating the locking ring and simplifying the manufacturing process, machining time and costs are reduced. So in essence, Lucia KPro is intended to be more affordable and more accessible to patients around the world. Now, how do you assemble this device? So in this video, we will show you how to specifically assemble it so you don't have to go through the same bit of anxiety on your first cases as a surgeon putting this together. Now, compared to the conventional KPro for adults, which uses like an 8.5mm backplate, the Lucia design features a smaller 7.8mm backplate. Now, this allows for greater flexibility in donor graft sizing. While smaller punches such as 8mm may be used, I personally prefer an 8.5mm punch to allow a margin of error for centration. So Jay did the assembly here. Tell me what you're doing here, Jay.
Here, I punch the center using a 3mm dermal punch. After which, it is important to gently move the corneal tissue to ensure there are no residual attachments. In one of the cartridges, there's a sticker to hold the optic stem in place. Here, I drape the corneal donut over it. Don't worry if you touch the endothelial surface. It's not going to be viable anyway. Then, I put gel over the back surface of the corneal tissue to facilitate smooth assembly. The back plate is gently seated over the optic stem, ensuring proper alignment within the groove. Using the wider end of the plunger, I lock the device in place. You will feel and hear several clicks, culminating in a distinct thunk indicating a secure assembly. When you remove it from the sticker, make sure to gently tease it out or else you might drop it.
In the event that you do, what do? Do you just cancel your case?
Dolman says just to put them in povidone iodine, because it is apparently very safe for removing contaminants on these devices. And if you put them in autoclave, obviously the optic stem will melt.
Yes, agree. Okay, so all components required for assembly are provided within the package, streamlining the process. Now, here is a one-eyed patient with multiple graft failures. Now, this is his potentially only seeing eye. So we go about with the process like a normal corneal transplant case, but for this case, I specifically selected a Lucia KPro designed for aphakia because I'm not sure of the patient's lens status. He'd undergone prior surgery elsewhere, and the corneal scarring was quite dense, limiting my visualization and, making preoperative assessment quite challenging for me. Now, if a pseudophakic option were used in a setting of uncertain lens status, this could also introduce several risks like IOL optic contact, progressive IOL decentration, and although YAG capsulotomy is possible, it still can be, technically more challenging through a KPro. A pars plana vitrectomy is highly recommended in these cases to optimize outcomes. However, if a patient is not amenable, an anterior vitrectomy may be performed as an alternative. Here, I proceeded with implantation using nylon 10-0 sutures, similar to a standard keratoplasty. One important technique is to grasp the suture needle from the side, avoiding contact with the central optic as much as possible. The Lucia backplate resembles a more physiologic iris appearance compared to the traditional Swiss cheese design. It is available in brown and blue, and in this case I chose brown because the patient is Asian. Now, beyond cosmesis, the radial pattern of the backplate serves as a useful visual guide, helping ensure evenly spaced radial suture placement, which, enhances the centration and the overall surgical precision. And I like that about Lucia KPro.
Really smooth surgery and satisfying radial suture placements.
Thank you very much. I try my best to continually refine my technique. And here are some surgical pearls that may be valuable in your future KPro surgeries. So thank you for watching, and I hope you learned from this video that we prepared. Don't forget to like and subscribe.